Let's take you now to our top story. The full report from NTV's Eunice. Omollo Health Cabinet Secretary Sicily Kariuki has sent Kenyatta National Hospital CEO Dr. Lilly Koros and the Director of Clinical Services Dr. Benard Githae on compulsory leave. This is after a brain surgery was conducted on the wrong patient on the 19th of this month. Last month. It is believed that the mix-up in the two patients occurred due to wrong tagging of the patients. Here's the story.
An operation that has left many Kenyans with more questions than answers. A patient who did not need brain surgery underwent one at the Kenyatta National Hospital, while the one who ought to have undergone the surgery did not.
The mix-up started at the point of dressing the patient, because the patient who was taken to theatre had the names, but those names belonged to the one who ought not have to have been wheeled to theatre. So the process started at that point. The confusion started at that point.
The surgery registrar who operated on the patient realized that the patient that was wheeled into the theatre did not have a clot in the brain hours into the operation before informing the consultant in charge.
Directed the board through the chair that the CEO of this organization, with the colleague responsible for clinical matters of this hospital, are sent on compulsory leave forthwith, and in their place, 2 experts will be taken over to run this institution for the period the investigations will be done.
Earlier today, a closed-door meeting was held at the hospital that brought together the hospital's management and a special medical practitioners council, questioning the suspension of rights of neurosurgery of a registrar who conducted the surgery.
There are 3 critical people who must assess a patient prior to theatre. The first person who must see this patient is the person who is actually going to conduct that surgery. The anesthetist who is going to administer the anesthetic drugs must come, assess this patient, and make note that actually this patient will go to theatre and is able to sustain anesthetic drugs. This assessment must take place in the ward before the patient is wheeled to theatre. So the issue of patient identification, if it is wrong, are you telling me that these doctors are they're just operating on like robots? Are they robots? That they're just in theatre, static in theatre, waiting for bodies to come?
The horror mix raises questions on the systems in the largest referral hospital in the country.
We will have to move in and put systems so that we don't have to see a repeat of this going forward. I have directed the board accordingly to put in, using an external third-party audit firm, a quick investigation to audit the systems in respect of patient safety, also following what we had of a matter which involved a child 2 weeks ago. I will be expecting the board comes into a consultation tomorrow. Then
the 2 patients are recuperating at the health facility, and the government will foot the bills that will be incurred during their stay at the hospital. The CS Health Sicily Kariuki has tasked a special board of investigations to look into the occurrence of the 19th of February at the Kenyatta National Hospital. Eunice, Omollo, NTV.